Hi, my name is Janice Cowden. I'm originally from Ohio, but we've lived in Florida now for the past 14 years. I am actually a retired pediatric nurse. That was my part-time career for about 20 years while I was raising children. Science and nursing and healthcare has always been a passion of mine. I'm also a mother of 2 grown children. They are parents of 3 of my grandchildren who are ages 5, 4.5, and 3. I've spent most of my life raising children, enjoying time with friends, reading, traveling. I absolutely love to travel. And now I have grandchildren that I get to travel to see because we live in different states. And I've also been married for 41 years. As a matter of fact, our anniversary is today. And my husband's retired from an engineering firm, and we've done a lot of traveling through his work as well. I love to be outside. I love summer, which makes living in Florida excellent because it is full of sunshine and warm weather. I love to swim. I have a pool that I try to get in at least every day. And I love to spend time with friends. On the quiet side, I love to read. Nonfiction is my preference, but it sort of helps me escape from the real world, and I'm an avid reader. I actually found a lump in my breast approximately 2 years before I was diagnosed with stage 1 triple negative breast cancer. Unfortunately, the area did not show up on mammograms because it was so far back and up close to the sternum. And I talked to my gynecologist about it. She couldn't feel it. It was tiny when I first discovered it, and it was tender. And at the time, my gynecologist said, "Oh, don't worry about it. It's tender. Cancer isn't painful in the breast." So I didn't get too concerned about it, but in my annual mammogram, I asked the imaging technician if she would really focus on that area. And it was difficult to get it into the image because of the location of the tumor. But we made it happen. And although it was quite uncomfortable, I'm glad we did, because that's when we discovered that I had a 1.5 centimeter tumor. And I had a biopsy, which the pathology showed that it was invasive ductal carcinoma. It was triple negative. And I had a lumpectomy following that. And it was a 1.5 centimeter tumor that they removed. Following that, I had brachytherapy radiation, where they inserted a catheter into the lumpectomy bed site and delivered radiation twice a day through little beads that went into the catheter. And following completion of that, which there were a total of 10 rounds of brachytherapy radiation, I then had 4 rounds of chemotherapy and was cancer-free until I wasn't. So I had about 5 years of thinking I was cancer-free before I was re-diagnosed with metastatic breast cancer. I was at one of my routine oncology appointments, and I had complained to my oncologist that I'd had a lot of bone and joint pain over the past 6 to 9 months. And my mammograms were normal. So at that point, since triple negative tends to reoccur within 2 to 3 years after diagnosis, he decided we would do a PET scan, even though he didn't expect anything to come back on the PET scan, since we were almost 5 years out from my early stage diagnosis. So we did a PET scan, and turned out I actually had 4 hypermetabolic lymph nodes. 3 were in the same area as my original breast cancer on the left side, and then 1 was a hilar node on the right side. My oncologist explained that I was stage 4 and that he would be treating me to manage the cancer, but it was not curable at that point. Pathology came back that it was a recurrence of triple negative breast cancer. And at that time, I was devastated. My husband and I both cried in the appointment. My oncologist cried. And I knew that stage 4 metastatic breast cancer was incurable. And I knew that it was also a terminal disease. And unfortunately for triple negative, the median overall survival is about 18 to 24 months from diagnosis. So I was devastated, just absolutely devastated, as was my husband, my oncologist, my family. I had to go home and pull myself together in order to make the important phone calls to my children and let them know that not only had I experienced a recurrence of my early stage breast cancer, but now it was stage 4. And I had to explain to them exactly what that meant, and that it was terminal and incurable. So I did a lot of research on treatments, on statistics related to triple negative metastatic breast cancer. And although the prognosis appeared very dim and very poor, I decided I was going to give it all I had. And so I went into chemotherapy with the intention that I was just going to live each day at a time and do the best I could and appreciate each day that came along. After that, I had 4 rounds of chemotherapy, and then we did a PET scan at the end of that 4th round, and I had no evidence of disease at the time. So I was considered an exceptional responder because triple negative is a very aggressive form of breast cancer and doesn't always respond well to treatment. So we decided that we would just scan and watch for progression. So I had a PET scan. 3 months later, I was still no evidence of disease. And then we stretched the PET scans out from 3 to 5 months, and I remained no evidence of disease. And I am now nearly 4 years as no evidence of disease. This doesn't mean that I'm cured. I don't consider myself to be in remission. We simply scan to look for evidence of disease every 6 months. I'm very, very fortunate. My husband is an excellent caregiver. He was there beside me and has always gone to every appointment with me. And he was scared. And so we did a lot of reading together. We did a lot of researching together and decided that we would just make the most of life while we had it. When I was first diagnosed, I wanted to do research just to learn as much as I could about the treatments I was going to be getting, as well as the science behind the disease. With a nursing background, I always appreciate knowledge. And for me, knowledge is empowering. And it's the unknown that really causes me a great deal of anxiety. So as I was researching, I knew how important it was to use valid resources, not just Googling and reading anything that was out there on the internet. So I had a couple of organizations that I had followed after my stage 1 diagnosis, and one of those was Living Beyond Breast Cancer. They had a great deal of resources on their website, and then I discovered that they also had a metastatic breast cancer conference every year that they hosted in April in Philadelphia. So I became more interested in that organization and how I could possibly utilize the time that I had to advocate for metastatic breast cancer. So I applied and was accepted and trained as a Hear My Voice advocate. Prior to that conference, which is when they do the training, I had not met a single person with metastatic breast cancer. And walking into the big ballroom on the first day of LBBC's Metastatic Breast Cancer Conference and seeing 300 to 400 other people who were mostly living with metastatic breast cancer was overwhelming. But I was finally in a space with other people who understood and had knowledge about my disease, and it was so empowering. So I've always used LBBC as a great resource. I'm also a helpline volunteer for them, and I use breastcancer.org for a lot of information just regarding metastatic breast cancer. And Triple Negative Breast Cancer Foundation also has a great deal of information available on triple negative breast cancer. And then there were other organizations that I discovered as a result of becoming a patient advocate. METAvivor was one of those organizations, and I discovered that what was really needed in the metastatic breast cancer community was research. And I also learned that even though breast cancer research gets a great deal of funding, metastatic breast cancer research in specific gets less than 10% of all breast cancer research funding. So I decided that I needed to get on board and advocate for more research funding. So I became a peer support leader with METAvivor. I also volunteer, and last year I attended their annual Stampede in Washington, DC. So those are several organizations that I have found have been beneficial in a multitude of ways, both for advocacy and as a patient living with metastatic breast cancer. The community that we have with metastatic breast cancer patients is unlike any other. We become friends very quickly because we don't know how much time we have, and we offer each other a great deal of support, both emotional and social support, as well as advocacy support, which is so important. I share my story through social media because I think it does two things. First, I think it can inspire hope because it is fairly rare for someone with metastatic triple negative breast cancer to have a complete response to treatment. I often say that I've outlived my expiration date, which would have been over 2 years ago. But I think we need to bring education and awareness about metastatic breast cancer in general. And by sharing my story, I educate and inform. And I don't think the public realizes that we lack in funding for research. And the only thing that's going to change the landscape of metastatic breast cancer is research. And to get 7% of all breast cancer research funding is it's unacceptable. We lose 116 people every day in the United States to this disease. And 1 in 3, or approximately 30% of those who've been diagnosed with early stage breast cancer and have gone through successful treatment will be re-diagnosed as metastatic breast cancer at some point in their life. It could happen immediately, 10 years later, 20 years later. So I think the public needs to be educated about what metastatic breast cancer is, the fact that it's incurable. Unfortunately, even though some organizations will state that the death rate for metastatic breast cancer has decreased over the last couple of decades, that really isn't true when you look at these statistics. As 116 people dying every day in the US has not decreased. In fact, it's increased over the last decade or two. I think the way the numbers are formulated and presented, because there is a higher incidence of more people being diagnosed with breast cancer, yet our rate of morbidity from metastatic breast cancer has been stagnant, it makes it look like people are no longer dying at the same rate from metastatic breast cancer. And it's just simply not true. So I take my story to social media to educate and inform, and also to encourage people to, especially during the month of October, when we're looking at Breast Cancer Awareness Month, to realize that early detection doesn't necessarily save lives. There are 6 to 10% of those who are diagnosed with metastatic breast cancer from the very beginning, known as de novo. Many of these young women are too young to have ever had a mammogram, and it is an aggressive form of breast cancer in young women, and they're dying. I have friends that are dying every month, and I think it's important for the public to understand that, yes, it's important to detect breast cancer early on, but it's not necessarily going to save lives. So the focus should be on research. I believe that Breast Cancer Awareness Month should really be Breast Cancer Action Month. And I think that action needs to be funding research. One thing I wish the public knew about metastatic breast cancer is that most patients who are diagnosed with this disease are in treatment for life. They never cease treatment. They don't get to ring a bell at the end of treatment to celebrate being a survivor. I think that's an extremely important thing for the public to know, is that treatment doesn't end. We have a saying called scan, treat, repeat, because until they die, patients with metastatic breast cancer are getting treatment every day. Metastatic breast cancer has many challenges, or creates many challenges. I think the 3 most challenging things for me come from the fallout of side effects that treatments can cause. Having had chemotherapy, there are a lot of things that go along with that. It is a challenge to always stay on top of scans and scheduling. You know, it's constant. Every 3 months I see an oncologist, and I'm fortunate, because I'm no evidence of disease, that I am not in a cancer clinic getting treatment every week or every few weeks. So that is actually a blessing for me. But the side effects, and those can be immediate or those can be long-term, that treatments cause, keep us vigilant. We have to always stay on top of things. I have to see a cardiologist because one of my chemotherapies can cause cardiomyopathy and has cardiotoxicities. I have to have PET CT scans every 6 months. I get those done out of state, so I have to schedule travel arrangements to get the appointments and to get my flights, the hotels, the transportation. And locally, I see my oncologist here near where I live every 3 months in between, or every 6 months actually. So I'm seeing an oncologist every 3 months. But Advocacy also added to that. There are a lot of webinars and meetings that I'm always a part of, which is wonderful because I'm always learning. I'm learning the science, I'm learning from other people, and I feel like it makes an impact. So that is a challenge, but yet it is also something I'm very grateful to be able to do. And I think the other challenge is simply trying to educate other people. I find that to be a huge challenge, because no matter what you say, there's always more to learn. And I think that's very, very challenging to get people to understand that, they need to fund research, and that I am only one example of people who are diagnosed with metastatic breast cancer. And my circumstance is not the normal circumstance. Most people are in treatment, and I am not. So that is, I think it's a difficult challenge, especially with my closest friends and family members, to make them understand that my situation is very unique and not the normal situation. As someone who's had metastatic breast cancer for over 4 years, I think one of the most valuable lessons that someone who is newly diagnosed can learn is to not assume that they are a statistic, to not put themselves in a timeline and make the automatic assumption that based on statistics, they won't be here, whether it's today or tomorrow or next year. We're not numbers, we aren't statistics. We fall on both sides of those overall survival statistics. And I think one of the things, besides not putting a calendar date on their life, is to learn to take it one day at a time. Although we may not feel comfortable planning long-term for the future, we get up each day, we take it one day at a time, and we simply do our best. And to not put expectations on ourselves about how we should feel or how we might feel the next day, and to allow ourselves grace and patience, because it takes time to adjust to this new normal, or new abnormal, really. I can remember the first year being extremely frightened and thinking that, I didn't necessarily think that I wouldn't be alive the next day, but I wouldn't plan anything. I wouldn't plan anything longer than a month in advance. And what time has taught me over the last 4 years is that it's okay to plan, and it's okay to be hopeful. And with each day that we're here, it presents new challenges, but it also has the opportunity to present new joys, and to network with others, to get involved with others who are living with this disease, because the support that's available out there is abundant. Regardless of how you find that support, whether it's through calling helplines, whether it's through a social media platform, or an in-person support group, I think having support outside of our immediate family and caregivers and friends who aren't living with metastatic breast cancer, I think it's extremely important to find that support in the metastatic community and from the metastatic community. And more than anything, I think it's just allow yourself time and patience and grace while you adjust. There will be good days, there will be bad days, but you take it one day at a time. COVID actually has had an impact on me and my family. Normally, with our children and grandchildren living out of state, we would travel more frequently to see them. And with the restrictions that COVID has put on traveling and exposure to other people, it has definitely cut back on that for us. So we have to rely on digital means to interact with our children and grandchildren. So that it has had an impact in that way. And, it's had an impact on me as far as traveling to get my scans done. I had my scans canceled because they were not scheduling patients who lived out of state to come and get what they considered routine scans. One of my biggest concerns was the fact that I might get sick myself. Although I am not immunocompromised, according to the definition, because I'm not taking any type of medication or treatment that would cause my immune system to be suppressed, I do have radiation damage in my right lung. And for me, the risk was if I did get sick, I might have issues because my right lung is compromised just due to the scarring from radiation. And in fact, I did get sick, and I was sick for about 5 to 6 weeks. I tested negative for COVID, but my primary care physician is still convinced that I had a false negative test. But it was the sickest that I have been from a respiratory standpoint probably in my entire life. And I was scared that I might be hospitalized and that due to the compromised lung, that COVID might kill me. I think one of the most difficult things that I've experienced related to COVID in 2020 is the fact that I would normally be traveling and attending breast cancer or metastatic breast cancer conferences. And due to COVID, those conferences have all been virtual this year. So I have actually attended 4 conferences to date virtually. And the sad thing about that is not only do I look forward to these conferences to learn more about the science behind my disease, but I rely on these conferences to see my friends that I've made in the metastatic community, and they're extremely important to me. And unfortunately, we never know when we're going to see each other again, or if we're going to see each other again. And I have had several friends die in 2020 from metastatic breast cancer. And unfortunately, I didn't get the chance to see them and say goodbye to them in person because COVID took that away from us. And we really do rely on that. And luckily, we can have virtual meetings through Zoom, and we can interact with each other virtually through the conferences, through the platforms at the conferences. But it's not quite the same. We absolutely cherish the times that we get to see each other and give each other hugs, and we've not had that opportunity in 2020. And it's really, I think, caused issues for all of us. You know, there's a loss that's created there by the inability to get together and see each other. And there's opportunities for networking that are lost through virtual conferences as well. So it really has had an enormous impact on me, both as someone living with metastatic breast cancer and as a patient advocate as well. I think moving forward, we've recognized that there are great opportunities and advantages to having virtual conferences. The outreach is enormous. More people are able to attend that wouldn't normally be able to attend because they couldn't travel, either due to health reasons or financial reasons. So it has created that advantage. But I think moving forward, I really need to see my friends who are living with this disease. I need to hug and get hugged, maybe through platforms where the conferences are offered both virtually and in person, to extend the outreach and the availability to those who, for whatever reason, can't attend live. But I'm hoping that we also get the opportunity to travel again and to see each other. Perseverance to me simply means getting up each day, moving forward, and educating others, informing others, and making each day count. Each day needs to start with a feeling of gratitude for waking up that day, but not only that, for all of the gifts that life gives us. And I think perseverance means moving forward, always moving forward. There are things that stop us in our tracks, but we take those moments and we allow ourselves to feel what we feel in those moments, but we move forward. And I think despite all of the sadness, the grief, the struggles that go along with metastatic breast cancer, perseverance just simply means taking one day at a time and moving forward.